healthcare. It's enough to make anyone's head spin. Trying to break it down on your own can be so confusing. But how do you know that you can trust the professionals to know your needs well enough to find you and your family the best plan? Well, our next guests are here to help. Joining us now are Rascionato and Anthony Recupero, the owners of CMA Health Agency. Welcome to the show, gentlemen.
Thank you.
All right, let's talk about how much people are actually spending on health insurance. Are people spending too much, do you think?
People are spending too much. One of two ways. They either don't have the right plan, so it's going to cost them more in the end, or they're spending too much up front for their plan premiums because they don't know which plan to purchase.
And how is CMA going to help with this?
We spend some time to educate people, and so we're an independent agency, which means we can work with almost every company, so we find what's right for our clients and get them the best plan based on their needs.
Now, you are a healthcare advocate. What exactly does that mean, and how will you help me?
Well, I kind of get between you and the insurance company. So, for instance, if you get a bill in the mail, you're not sure if you're supposed to pay it, don't pay it. Give me a call. Let me get involved. Had a customer this week. She got a bill for $1,300 and did not think she had to pay it. I called the company and found out they just had the wrong address for the insurance company. So it wasn't being paid by the insurance company correctly. So we got that straightened out. I took the brunt of the problem instead of the client, so she's much happier.
Do you think this happens a lot, that people are
Quite
getting
a lot. People
stuff?
get bills in the mail. They think they owe it. They just pay it. They don't want any problems. It's better to know what it is that you're paying.
Right.
And if you're not sure, that's what I do.
In fact, that happened to me today. I got a bill in the mail, and I thought, gee, this is old, and why am I only getting it now? But unbeknownst to me, I had paid it 3 months ago, but I still got the bill, and had I not checked, I would have paid it.
Exactly, and they're going to keep sending it to you because...
Right, because I keep paying it. Who wants to do that?
Exactly.
So a lot of people obviously are probably thinking there's got to be a large cost involved in having a middleman. Is there?
There is not. With us, we do not charge a broker's fee. We get paid by the insurance company. So we feel if we can give you good service, if we can take care of your needs, you're going to continue to use us as your agent and client advocate and stay with us.
So let's just talk about the choices. How do you help somebody wade through it all to find out what's best for them and their families? How do you figure that out?
The big key is education. And so first we start with giving the basics of healthcare. Here's how healthcare works. Here's what a deductible means. Here's what a maximum out-of-pocket means. Then we do a little interview with the client to find out what their needs are, what they're trying to accomplish for them and their family. And then we design a plan around that and let them pick which one they're comfortable with.
Do you find a lot of people come to you and say, I just want to pay the least amount possible, but they don't think about the deductible? Somebody in this room may have done that this year.
Yes, we find that quite often. Unfortunately, they find out that maybe they can't see their doctor for 6 months, or their doctor's not in the network because there's so many networks out there now.
Right.
And so that's a big problem people are running into.
I'm curious to know what kind of time frame people are looking at, because everybody should be covered now, but not everybody is, and they want to get covered. So how quickly can this process take?
Well, the open enrollment period this year actually starts November 1st.
Okay.
So I think it's November through January 31st. So you need to sign up during that time in order to have coverage for next year.
Okay, good to know. Thank you, Rascionato and Anthony Recupero. And for more information on CMA Health Agency, just head to their website. It is cmahealthagency.com, or give them a call at 855-258-2580. Good to know there's somebody looking out for you. Thanks, gentlemen.
Thank you.
Thank you.
We'll be right back.